Hello, I am Dr. Rohit Ranade. I am a senior consultant and clinical lead, gynecological oncology, robotic surgery, and peritoneal surface oncology at the Narayana Health City in Bangalore. Gynecological cancer are the cancers which affect the reproductive system of the women. These are mainly the cancers which affect the uterus, ovaries, fallopian tubes, the vagina, and vulva. If you take the statistics, gynecological cancers are the most common cancer which affects women. If you take breast cancer and cervical cancer, they are the first and the second most common cancer in women, not just in our country, but also in the world. Now, if you look at statistics, the cervical cancer is the second most common cancer in women in India, followed by uterine cancer and ovarian cancer. And if you look at other uncommon cancers like vaginal cancer or vulval cancer, which is a cancer of the external genitalia, but they are also cases are found of these cancers. So unfortunately, what is happening is 70% of cases with gynecological cancers are diagnosed late. That is, they are in advanced stage, either a stage 3 or a stage 4 cancers. Now, there are different reasons why they are diagnosed late. Now, majority wise, it is because women are not aware of their symptoms. They often neglect their symptoms and don't seek help. Like, for example, cervical cancer is one cancer. As I told, it's the second most common cancer in women in India, with about 1 lakh new cases every year. The symptoms of cervical cancer are often neglected. Like, for example, if you have bleeding after sexual intercourse or bleeding outside your cycles. So most of the times these are neglected, and that's why patients come in advanced stages. Coming to other cancers like ovarian cancers, the symptoms are very non-specific, like just a mild pain in the abdomen or just a bloating or just a sense of not being well. So that is the reason why these cancers present in the advanced stage. But mostly it is a combination of lack of awareness and women not being seeking help when they actually have to, and neglecting their symptoms, and some non-specific symptoms as well. So we will look at it for the common cancers. Now, for cervical cancer, as I said, it's the most common cancer in women. Now, the most important symptom is bleeding after sexual intercourse. Another is when the bleeding occurs outside the menstrual cycle. Another important early warning sign is excess white discharge. When it continues for a long period of time, should not be ignored. These are three most important clinical features or symptoms which somebody should not ignore. As far as the uterine cancer is concerned or endometrial cancer is concerned, any bleeding after menopause, after the woman has got menopause, should not be ignored. But we are also seeing this cancer more common in younger patients. So in them, when the bleeding occurs, when there is heavier bleeding in the menstrual cycle or bleeding outside the menstrual cycle, should not be ignored. As I said, for ovarian cancer, the symptoms are very, very non-specific. But anything which is sort of making you feel unwell, if there is bloating of the abdomen, if the abdomen is distended, or it may be as simple that you have to go and pass urine more frequently, or you are feeling that you are not passing your motions correctly, you are getting a sensation that your bowels are not emptying properly, are maybe warning signs of ovarian cancer. As far as vulval cancer is concerned, the warning signs are any swelling or ulcer which is there on the external genitalia should not be ignored, and you should seek the help of a doctor.